Cardioselective beta blocker, to remember that, first 2A, atenolol, acetabutalol. Then 2B, bisoprolol, betaxolol. Then C, celiprolol. Then esmolol, nebivolol, and the last is metoprolol. Metoprolol is the one of the most commonly used beta blocker. In non-selective, there is with intrinsic activity, without intrinsic activity. With intrinsic activity, that means intrinsic sympathomimetic. Beta blocker means they blocks the beta, they reduce the action of the beta. Sympathomimetic means they also have partial agonistic activity. One of them is pindolol. Without sympathomimetic or intrinsic activity, they propanolol, sotalol, and timolol. Timolol used in glaucoma. So all these have without sympathomimetic activity. That means with sympathomimetic means they have a partial agonistic activity on beta receptor. Beta receptor present in, what are present? Heart, kidney. তাহলে কটা আছে? beta 1, beta 2. Beta 1 present in heart and JG cells in the kidney. Beta 2 present in the smooth muscles of tracheobronchial tree, vessels, and genitourinary tract, uterus, and GIT. Smooth muscles. Beta 2 present in the smooth muscle. Beta 1 present in either heart or JG cell of the kidney. And with additional alpha blocking activity, they are beta blocker with alpha blocking activity, carvedilol and labetalol. So classification of beta blocker, one is cardioselective, cardio non-selective. Cardioselective কি হয় মনে রাখতে হবে? At 2A, 2B, then C, then esmolol, nebivolol, আর metoprolol. 2A কি? Acetabutalol, atenolol, bisoprolol, betaxolol, then celiprolol. These are cardioselective beta blocker. Cardio non-selective, we can divide it into 3. One is with alpha blocking activity, carvedilol and labetalol. Then with intrinsic sympathomimetic activity, that means it is a beta blocker along with some partial action, agonistic action in the beta blocker. Beta receptor is pindolol. Then without, there are 3, you have to remember. One is propanolol, it is a prototype drug of the beta blocker. Then sotalol, it is an antiarrhythmic, class 3 antiarrhythmic. And timolol, it is used in glaucoma. Clear? এই পর্যন্ত? Then where it is used, they are used, we can divide it in cardiovascular system and non-cardiovascular system use. In cardiovascular system, you have to remember what are the different drugs used in CVS. One is hypertension, number 2 angina and myocardial infarction, then arrhythmia, and last one is congestive cardiac failure. তাহলে এই 5টা যে সিভিএস ওরিয়েন্টেড, তাতে প্রত্যেকটাই তোমাদের আবার সিভিএস এ গিয়ে পড়তে হবে, তাতে সবকটাতে বিটা ব্লকার ইউজ হয়। কি? হাইপারটেনশন, অ্যানজাইনা, মায়োকার্ডিয়াল ইনফাকশন, কনজেস্টিভ হার্ট ফেলিওর অ্যান্ড কার্ডিয়াক অ্যারিথমিয়াস। ক্লিয়ার? এগুলো ইম্পর্টেন্ট কেন? প্রথমে ইউজ অফ beta blocker in long question as well as in viva, and explain why, how beta blocker acts in hypertension, how beta blocker used in angina, in myocardial infarction, in arrhythmias, and in congestive cardiac failure. Clear? Other than these 5, 2 other CVS use is there for the beta blocker, that is dissecting aortic aneurysm and hypertrophic obstructive cardiomyopathy. Aneurysm, what is aneurysm? aorta dilate হয়ে যায় এবং সেখান থেকে ডিসেকশন মানে ছিঁড়তে আরম্ভ করে, that means dissecting aortic aneurysm. And last one is obstructive, that is hypertrophic obstructive cardiomyopathy. So there are 5 cardiac use of beta blocker, namely hypertension, angina, myocardial infarction, arrhythmia, heart failure. Other than this, 2 important is COHM, that means hypertrophic obstructive cardiomyopathy, then dissecting aortic aneurysm. These are all cardiac use or CVS use of beta blocker. Now other one, other than, that means non-cardiac use of beta blocker, non-cardiac use of beta blocker. Pheochromocytoma. What is pheochromocytoma? Adrenal gland শুনতে পাচ্ছি, তার আগে কি বলছি? হ্যাঁ, ক্যান্সার, neoplasia, that is a tumor of adrenal gland. And what is the presentation? How patient can present with outdoor or emergency? কি হবে পেশেন্টের যদি টিউমার হয় অ্যাড্রেনাল গ্ল্যান্ডে? হ্যাঁ বলো, এটা তো পড়ানো হয়েছে আমি জানি। হ্যাঁ বলো, কোথায় পড়ানো হয়েছে জানো? হ্যাঁ, এন্ডোক্রিন পড়ানো হয়ে গেছে। ক্যাটেকোলামাইন সিক্রেশনে আলফা ব্লকার পড়ানো হয়েছে, ফেনক্সিবেনজামিন পড়ানো হয়েছে। ফেনক্সিবেনজামিন, হোয়াট ইজ ইট? It is a non-selective, non-equilibrium type of non-selective alpha blocker. It is, first use is pheochromocytoma. Pheochromocytoma is a tumor of adrenal gland where there is a excess amount of secretion of adrenaline and noradrenaline. Clear? So how this patient present? This patient can present with hypertension, palpitation, headache, dizziness, sweating. So a patient present to you with a hypertension in an early age group as well as late age group with a high BP can be a chance of pheochromocytoma. The drug of choice of pheochromocytoma is phenoxybenjamin. Very good. It is the first line drug is phenoxybenjamin. Then if it is not controlled by phenoxybenjamin or before the operation, we can add beta blocker. There is a explain why we prefer alpha blocker over beta blocker in pheochromocytoma. Why we prefer alpha blocker over beta blocker as a initial therapy of pheochromocytoma. Keno? So pheochromocytoma is a tumor of adrenal gland. They secrete excess amount of adrenaline and noradrenaline. If we give beta blocker as a primary or initial therapy, beta blocker, so what they do? They block the beta receptor present in the heart and present in the smooth muscle of the vessels also. So what happened? All these adrenaline and noradrenaline go and stimulate the alpha blocker, where especially alpha 1, where it is present? Alpha 1, blood vessels. So if it is going to and stimulate the alpha 1 in blood vessels, what is the resultant effect? There will be vasoconstriction or dilatation. হ্যাঁ, vasoconstriction হয় না dilatation হয়? Alpha constriction, and that can lead to hypertensive emergency. So patient already present with a hypertensive state, and there is a increased hypertensive state that can lead to hypertensive urgency emergency. So before giving beta blocker, we always give alpha blocker in case of pheochromocytoma. তাহলে কি হবে? If we give alpha blocker first, they go and block the alpha 1 receptor present in the smooth muscle of the blood vessels. So they are occupied. Now already blood pressure will be reduced. If it is not controlled with alpha blocker, then we add beta blocker, because even then if it is blocked the beta blocker, alpha blocker is already blocked. So remaining of this adrenaline and noradrenaline not able to stimulate the alpha blocker. Clear? এই পর্যন্ত? It is explain why we prefer alpha blocker over beta blocker as a first line drug, or we give alpha blocker before beta blocker. Clear? If we give beta blocker as a first time, there is unopposed stimulation of stimulation of a beta blocker dile alpha blocker present in the blood vessels, resulting to vasoconstriction and leading to hypertensive emergency and urgencies. But there is a use of beta blocker in pheochromocytoma, but it is as a second line drug of the pheochromocytoma, or if it is not controlled by the alpha blocker. Clear? Next is thyrotoxicosis. In thyrotoxicosis, there is a peripheral conversion of T4 to T3, and this T3 is more potent and it is responsible for their actions of this thyroid. It doesn't alter the synthesis or release of the thyroid, but it prevents the peripheral conversion of T4 to T3, and that is helpful in the thyrotoxicosis. Clear? Beta blocker is not alter the synthesis or release of thyroxine, either T3 or T4, but their peripheral conversion from the T4 to T3 is inhibited, and T3 is responsible for the action. So if it is peripheral conversion is less, the state, if there is thyrotoxicity, can be controlled. So second use of non-cardiac use of beta blocker. One is pheochromocytoma, then thyrotoxicosis. Third one is migraine. In migraine, there is a vasodilatation of cranial vessels. So by stimulating beta 2, there is a vasodilatation. If the beta 2 can be blocked, in case of chronic prophylactic, it is not as a acute use in acute attack, but as a chronic prophylactic use, they counteract this, block the beta 2 and prevent the dilatation. So it can be used, beta blocker can be used, propranolol can be used as a drug in prophylaxis to prevent migraine. Anxiety. In anxiety and tremor, essential tremor, beta 2 and as well as alpha 1 can be helpful. Blocking is helpful. In glaucoma, there is in chronic congestive glaucoma, beta blocker like timolol is helpful. So these are the non-cardiac use of beta blocker. Non-cardiac use of beta blocker: pheochromocytoma, thyrotoxicosis, migraine, anxiety, essential tremor, and glaucoma. The use of beta blocker, if as a part, it comes as a use of beta blocker in two heading. One is cardiac use or CVS use, one is non-cardiac use. In cardiac use, প্রথম পাঁচটা তো মনেই থাকবে কি কি? First one is hypertension, then angina. Angina spectrum হয়ে যায় myocardial infarction. Then fourth one is arrhythmias, and last one is heart failure. Clear? Heart failure. Especially chronic type of heart failure. Beta blocker used in chronic type of heart failure, not acute type of. These 5, other than this, there are 2. One is HOCM, that is hypertrophic obstructive cardiomyopathy, and dissecting aneurysm. These are the use of cardiac use of beta blocker. Cardiac use of beta blocker. Then there is non-cardiac use of beta blocker. First one is pheochromocytoma, but not as a first line. First line drug of pheochromocytoma is phenoxybenzaimine. It is a non-selective, non-equilibrium type of alpha blocker. ঠিক আছে? Second line drug is beta blocker. এখান থেকে একটা explain why we prefer alpha blocker or phenoxybenzaimine over propranolol or over beta blocker. Explain why. Similarly, thyrotoxicosis, how it helpful? It prevents the peripheral conversion from the T4 to T3, but it has no role in the synthesis or release of T3 and T4. Then migraine, beta 2 blocking, cranial vessel dilation will be less, anxiety, essential tremor and glaucoma. Clear এই পর্যন্ত? Use of beta blocker যদি long question আছে ভাই non cardiac, cardiac এ কি non cardiac এ কি Now how beta blocker helpful in as a antihypertensive. এখানে দুটো পয়েন্ট আছে এবং দুটো পয়েন্টই বলতে হবে। নাম্বার 1 is they block the beta 1 present in the heart. তাহলে beta 1 যদি হার্টে প্রেজেন্ট থাকে সেটা ব্লক করলে কি হবে? কি হয়? কন্ট্রাক্টিলিটি কমবে, হার্ট রেট কমবে, দেন অটোমেটিসিটি কমবে, আলটিমেটলি কার্ডিয়াক আউটপুট কমবে। কার্ডিয়াক আউটপুট কমা মানে ব্লাড প্রেসারে একরকম ভাবে কমা। ক্লিয়ার? Number 2, and you have to write this, that it also blocks the beta 1 present in the JG cell. JG cell block hole ki hobe? Less amount of renin will be released. As there is a less amount of renin release, their renin, angiotensin, aldosterone axis will be less stimulated. That also helpful for less amount of reabsorption of sodium and water. So দুটো point. Why বা how beta blocker helpful in hypertension? How beta blocker? One is by blocking the beta 1 they reduce the cardiac output, and number 2, by blocking the beta 1 present in the JG cell they reduce the sodium water retention and vasoconstriction. Both these have to be written to get the full marks. দুটো পয়েন্ট আছে, দুটো পয়েন্টই লিখতে হবে। হার্টটা শুধু লিখে দিলে হবে না, ঠিক আছে? হার্ট and JG cell, and that can lead to, by blocking the beta 1, by blocking that beta 1 they can helpful to reduce blood pressure. কি এক্সাম্পল? একটা হচ্ছে beta 1 in heart, they reduce the cardiac output. Beta 1 in the JG cell reduce the renin release, and renin, angiotensin, aldosterone system will be less active, less vasoconstriction, less amount of sodium and water resorption. Clear? How beta blocker used as a antihypertensive. Now how beta blocker used as a anti-anginal. How beta blocker can use as a anti-anginal. So before that, just a small amount. What is angina? Angina is a disbalance between the oxygen required in the myocardium and available oxygen. Clear? Why it is? Basic pathology is due to atherosclerosis, coronary artery become narrower. So less amount of blood there available in the myocardium. Less amount of blood means less amount of oxygen. So there are two processes: by dilating that coronary artery or by reducing the oxygen consumption. Clear? So beta blocker helps to reduce heart rate, as there is a reduced heart rate. Why? By blocking the beta 1 receptor present in heart. So there is reduced heart rate, reduced cardiac activity, so less amount of oxygen consumption. So there is this pain is due to the disbalance between required oxygen and available oxygen. Required oxygen will be less, so there will be less pain. Clear? Number 2, in angina, especially if you think about the beta 2 receptor primarily present in sub-epicardial region. তার মানে কি, একটা পেরিকার্ডিয়াম থাকে, এপিকার্ডিয়াম, মায়োকার্ডিয়াম, এন্ডোকার্ডিয়াম। এন্ডোকার্ডিয়ামের নিচে যে জায়গাটা, সেখানে there is a less amount of blood flow. So but beta 2 is much more present in the epicardium, sub-epicardial region. So they are not, by blocking the beta 2, they are not interfering with the blood flow in the subendocardial region. But in the other term, there is more amount of blood. If epicardium কম যাচ্ছে, তাহলে endocardium বেশি যাবে। Clear? So by blocking beta 2, non-selective beta blocker also helpful for angina. But first one in angina, they block the beta 1 receptor in heart. By blocking that, there is a less amount of heart rate, less cardiac activity, less oxygen consumption. So the disbalance between the available oxygen and required oxygen will be less by reducing the demand of the oxygen. Clear? Beta blocker as a anti-anginal. Beta blocker as a anti-anginal. How beta blocker can act as a anti-anginal? এটা বিটা ব্লকারেও থাকবে, আবার যখন সিভিএস পড়বে সেখানেও কিন্তু প্রত্যেক কটাতে বিটা ব্লকার আছে, তাহলে একটা করে পার্ট কিন্তু হয়ে যাচ্ছে। বিটা ব্লকার অ্যাজ এ অ্যান্টি হাইপারটেনসিভ, বিটা ব্লকার অ্যাজ এ অ্যান্টি অ্যাঞ্জাইনাল, দেন অ্যাজ এ অ্যান্টি অ্যারিথমিক। বিটা ব্লকার অ্যাজ এ অ্যান্টি অ্যারিথমিক, primarily it is a class 2 anti-arrhythmic, class 2, but sotalol is class 3 anti-arrhythmic. Clear? So class 2 anti-arrhythmic, they reduce extrasystole and tachycardia. How it can be reduced? By blocking the beta 1 receptor and by reducing the automaticity. চারটে জিনিস আছে না, কি কি হার্টে? কন্ট্রাক্টিলিটি, কন্ডাক্টিভিটি, অটোমেটিসিটি আর কি? Excitability. Very good. So by reducing this automaticity, they reduce extrasystole and tachycardias. By blocking the beta 1 receptor present in the heart. Now esmolol is used as a drug of paroxysmal supraventricular tachycardia. সুপ্রাভেন্ট্রিকুলার মিন্স ভেন্ট্রিকেলের উপরে যেটা আছে, কি আছে ভেন্ট্রিকেলের উপরে? অ্যাট্রিয়ামই আছে। সো অ্যাট্রিয়াম থেকে যে জিনিসগুলো পালস জেনারেট করে, কোথা থেকে পালস জেনারেট করে? এসএ নোড। ইফ ইট ইজ জেনারেটেড ফ্রম এসএ নোড, it is in sinus. That may be, if it is increased, sinus tachycardia. If it is decreased, sinus bradycardia. If the impulse generation is other than the SA node in other part of the atrium but above the ventricle, that is supraventricular tachycardia. In supraventricular tachycardia, due to reduced automaticity, esmolol is used as a drug of choice. One of the drug, not the drug of choice. Paroxysmal supraventricular tachycardia. Another thing, if in atrial fibrillation or atrial flutter, where their impulse is generated from the atrium, not from the SA node, in this situation the conductivity through the কোথা থেকে কন্ডাক্টিভিটি হয়? AV node will be reduced. That means if there is a 300 impulse generated from the atrium, and if all is transmitted to the ventricle, what will be the result? সবকটা যে 300টা 300 ভেন্ট্রিকেলে চলে যায়, there will be a ventricular fibrillation. What is fibrillation? What is the defect? If the ventricle stimulates 300 times in a minute, 300, there will not have effective cardiac output. তাই তো? এরা মানে কাঁপবে কিন্তু কন্ট্রাক্টিলিটিটা নষ্ট হয়ে যাবে। So by reducing the conductivity through the AV node, beta blocker reduce the impulse generated from the atrium transmitted to the ventricle. So there will be adequate amount of contractility in the ventricle to have a adequate cardiac output. Clear? So how beta blocker helpful in arrhythmia? Number one, by reducing conductivity, they reduce impulse conduction from the atrium to ventricle. That leads to adequate contractility and cardiac output generation. Another one, by reducing the automaticity, they reduce extrasystoles as well as tachycardias. Even paroxysmal supraventricular tachycardia, a small is used. Clear? As a hypertensive, as a anti-anginal, as a anti-arrhythmic. How it helpful in myocardium? It is in three phases. First one is secondary prophylaxis of the myocardial infarction by decreasing the subsequent mortality up to 20%. কি করে এখানে? প্রিভেন্টিং রি-ইনফাকশন, মানে একটা ইনফাকশন হওয়ার পরে সেকেন্ডারি ইনফাকশনটাকে প্রিভেন্ট করে বিটা ব্লকার। প্রিভেন্টিং সাডেন ভেন্ট্রিকুলার ফিব্রিলেশন, সেই ফিব্রিলেশনটা কিভাবে বন্ধ করে? বাই ব্লকিং the conductivity and automaticity in the ventricle. They reducing subsequent attack in the myocardial infarction. Second one is myocardial salvage during the evaluation of the AMI. Administered, if it is administered 4 to 6 hours of attack, they reduce the infarction side, reduce the oxygen consumption. They also prevent arrhythmias, especially in the ventricular fibrillation. Any ventricular fibrillation, ventricular flutter is more fatal than the atrial fibrillation, atrial flutter, because if there is a ventricular fibrillation or ventricular flutter, cardiac output will be less, and there will be immediate sudden death. If it is atrial, there is a AV node. They can control the rate of the ventricular stimulation, so it will give some time. Clear? A third one, the most important one, in the long term, it prevents remodeling of the myocardium. তাহলে 3 points. Number one, decrease subsequent infarction, secondary prevention. It is myocardial salvage by reducing oxygen consumption and ventricular fibrillation, and long term এর জন্য they also reduce the myocardial remodeling. There are few drugs that prevent myocardial remodeling. One is beta blocker, AC inhibitor or ARB. ARB means angiotensin receptor blocker, and spironolactone or aldosterone group. ঠিক আছে? Remodeling prevention by beta blocker, AC inhibitor, ARB, and aldosterone receptor agonist. But there is a catch, in which patient we can give beta blocker. If the patient is in a state of shock or cardiac arrest or cardiac failure, then we are not able to give beta blocker. We have to have heart rate more than 50 per minute and not higher than the first degree heart block. That means PR interval is less than 0.24 হলে সেটাকে ফার্স্ট ডিগ্রি হার্ট ব্লক বলে। মিনিমাম maximum first degree, if there is a second degree or third degree heart block, we cannot give beta blocker. The heart rate will be more than 50. Patient is not in shock. That means mean arterial blood pressure will be more than 70 to 80. Then we can give beta blocker in myocardial infarction. ঠিক আছে? Beta blocker in hypertension, beta blocker in angina, beta blocker in myocardial infarction, and beta blocker in arrhythmias. Clear? In heart failure, beta blocker is used in acute heart, not used in acute heart failure, but in chronic heart failure. First point is that it is not used in acute heart failure, but chronic heart failure. How it can act? It attenuates the adverse effect of high concentration catecholamine. In case of heart failure, there is a high concentration of noradrenaline and adrenaline. They have some side effect. Beta blocker can prevent it. Beta blocker upregulate the beta receptor present in the myocardium. Upregulate. They reduce the remodeling and they reduce the heart rate. So these are the 4 points why beta blocker is used in heart failure. First line ki likhte hobe, beta blocker is used in chronic heart failure, not in acute heart failure. It reduce heart rate, it increase the beta receptor upregulation. There is a prevention of remodeling and they counteract that side effect or adverse effect of high catecholamine state. Clear? তাহলে কি হলো? এই পাঁচটা যেন কোনো অসুবিধা না হয়। কি? হাইপারটেনশন, অ্যানজাইনা, মায়োকার্ডিয়াল ইনফার্কশন, অ্যারিথমিয়া and heart failure. In heart failure, it is used in chronic heart failure, not in acute heart failure. Clear? এই পর্যন্ত। নন কার্ডিয়াক ইউজ, থাইরোটক্সিকোসিস। থাইরোটক্সিকোসিসে কি হবে? থাইরোটক্সিকোসিস মানে কি? হাইপারথাইরয়েড না হাইপোথাইরয়েড? Hyperthyroid. In hyperthyroid, there is a state where there is a excess amount of thyroid release and they act in the peripheral organs. So which portion is more active, T3 or T4? T3 is more active. For their action, T3, there is a peripheral conversion from the T4 to T3 that can be inhibited by the beta blocker. So peripheral conversion of T4 to T3 is reduced, less amount of T3 is available for their action, but they have no action of synthesis or release of thyroid. How beta blocker helpful in thyrotoxicosis? In migraine, beta 2 present in where? Beta 2 এরকম ভাবে মনে হয়, beta 2 present in the smooth muscle. এবার সেই কোথাকার smooth muscle? First হচ্ছে blood vessels, then tracheobronchial tree, then GIT, then genitourinary tract and uterus. Clear? এর মধ্যে for migraine there is a vasodilatation of the cranial vessels which can be counteract if it is blocked by the এবার এটা কোন টাইপের বিটা ব্লকার এটা হেল্পফুল? কার্ডিও সিলেক্টিভ or কার্ডিও নন সিলেক্টিভ? কার্ডিও নন সিলেক্টিভ। দ্যাট মিন্স একটা নাম বলো কার্ডিও নন সিলেক্টিভে, propranolol can be helpful here, not atenolol. So explain why propranolol is helpful in migraine prophylaxis. এটা কিন্তু acute attack termination এর জন্য it is not used. It is helpful for prophylaxis of migraine. Why propranolol is helpful for prophylaxis of migraine, not metoprolol, atenolol. Clear? Because how mechanism of action? It blocks the beta 2 receptor present in the smooth muscle of cranial vessels. Essential tremor, non-selective, like propranolol is used by blocking both beta 1 and beta 2. In anxiety, propranolol exerts apparent anti-anxiety before the examination, unaccustomed public appearance due to blockage of peripheral manifestation. কি কি সেগুলো? Palpitation, tremor. So in anxiety, essential tremor, in migraine, which drug is preferred? Propranolol, non-selective. তাহলে কার্ডিয়াকের জন্য কোনটাই প্রেফার্ড? মানে হাইপারটেনশন, অ্যাঞ্জাইনা, কার্ডিওসিলেক্টিভ। নন কার্ডিয়াক ইউজের জন্য প্রোপানল। গ্লকোমা, it reduce secretion of aqueous humor and that lead to reduce IOP, intraocular pressure. In obstructive cardiomyopathy, the increased outflow resistance will be counteracted by the propranolol or beta blockers. Beta blocker improve the cardiac output. Precipitation of the heart failure. Precipitation of the heart failure, মানে আগে কার্ডিয়াক সাইড এফেক্ট ভাবো। প্রেসিপিটেশন অফ হার্ট ফেলিয়ার, দেন ব্র্যাডিকার্ডিয়া। যদি 6 সাইনাস সিনড্রোমে বিটা ব্লকার দেওয়া হয়, দেয়ার উইল বি ব্র্যাডিকার্ডিয়া। ইন কেস অফ নন সিলেক্টিভ বিটা ব্লকার ইউজ, দেয়ার ইজ এ প্রেসিপিটেশন অফ রেসপিরেটরি ডিস্ট্রেস ইন ক্রনিক অবস্ট্রাকটিভ পালমোনারি ডিজিজ। কেন হবে এটা? বিটা 2 সেটাও যদি আমি প্রোপানল দিয়ে ব্লক করি, তাহলে যে ডাইলেটেশনটা হবে সেটা কাউন্টার হবে। তবে there is a worsening of respiratory distress in chronic obstructive lung disease. Vasospastic angina. There are 3 types of angina. One is stable, one is unstable, and third one is variant. What is the difference? In stable and unstable, the main pathology is atheroma, atherosclerosis, by that lead to reducing the capacity of coronary artery. But in vasospastic, there is a vasospasm of the coronary artery. If in vasospastic we give beta blocker, they also prevent this dilatation of the coronary artery by blocking the beta 2 receptor, especially non-specific. Then precipitation or exaggeration of diabetes mellitus by reducing the tolerance of carbohydrate. তাহলে precipitation of the heart failure, precipitation of bradycardia, then respiratory distress in COPD patients. In case of vasospastic angina, beta blocker can be worsen this angina. তাহলে বিটা ব্লকার কোথায় ইউজ হবে? বিটা ব্লকার কোথায় ইউজ হবে? কোন টাইপের অ্যাঞ্জাইনা? স্টেবল, আনস্টেবল, মায়োকার্ডিয়াল ইনফাকশন। ইফ দেয়ার ইজ এ হার্ট রেট মোর দ্যান 50, there is no shock and there is no more than 1st degree heart failure, heart block. Clear? Carbohydrate tolerance, that means they can precipitate diabetes mellitus. Altered the lipid profile, triglyceride and cholesterol. They can supersensitivity of beta blocker, long term use causes agonistic stimulation. এটা কি হবে? যে if you continue beta blocker for long time, you cannot stop abruptly. Why? The already beta blocker will be, beta receptors are more upregulated. So if you suddenly stop the beta blocker, there is a sudden increase of blood pressure. So in this case, there is a reducing dose of beta blocker before stopping of this beta blocker. You cannot suddenly stop the beta blocker. আচ্ছা, ভেসোস্প্যাস্টিক অ্যাঞ্জাইনা তাহলে কোন ড্রাগ দেওয়া হবে? ভেসোস্প্যাস্টিক অ্যাঞ্জাইনা হ্যাঁ, nitrates. Nitrates is a drug of choice. Nitrates is a drug of choice for angina. It is drug of choice of vasospastic angina. Beta blocker is used in stable and unstable angina. It is contraindicated in vasospastic angina. In vasospastic angina, drug of choice is nitrate. There are three first line drug of nitrate. One is first line drug is nitrate. In angina, nitrate, beta block, then calcium channel blocker, then beta blocker. These are the first line drugs of angina. Clear? First line drug of hypertension is? Huh? No, nitrate no. A for AC inhibitor and ARB, then C for calcium channel blocker, and D for diuretics. ACD. Clear? এটা বুঝতে পেরেছো? তাহলে কি হয়নি? হাইপারটেনশনের ফার্স্ট লাইন ড্রাগ কি? AC inhibitor, ARB, then calcium channel blocker, and then diuretics. These are the first line drug. Angina first line drug ki? Nitrates, calcium channel blocker, and beta blocker. Clear? অ্যারিথমিয়ার পুরো আলাদা ক্লাসিফিকেশন আছে, ক্লাস 1, ক্লাস 2, ক্লাস 6 কোনটা কোথায় দিতে হবে। আর একটা কি পড়ে রইল তাহলে? হার্ট ফেলিওর। অ্যাকিউট কনজেস্টিভ হার্ট ফেলিওর, অ্যাকিউট হলে ডায়ুরেটিক্স, ফুসেমাইড ইজ আ ড্রাগ অফ চয়েস। ক্লিয়ার? সো ইন কেস অফ হাইপারটেনশন, in case of heart failure, beta blocker is not the first line drug, but beta blocker is important for all 5 elements. That means hypertension, angina, myocardial infarction, arrhythmia, and heart failure. But for only angina, it is considered as a first line. Even then, not for all. It is contraindicated for vasospastic angina. In partial and complete heart block, they can lead to cardiac arrest. Beta 2 mediated blood flow is reduced. They can reduce the exercise capacities and attenuation of the glycogenolysis and lipolysis. That is also lead to reduce exercise capacity. By blocking the vasodilator beta receptor, they worsening the peripheral vascular disease, Raynaud's disease. Beta blocker is contraindicated. Why? They counteract that beta 2 receptor present in the peripheral blood vessels. এই পর্যন্ত ক্লিয়ার? ইউজটা কিন্তু প্রাইমারি। তার আগে ক্লাসিফিকেশন অফ দ্য বিটা ব্লকার, কার্ডিও সিলেক্টিভ, কার্ডিও নন সিলেক্টিভ। নন সিলেক্টিভের মধ্যে আবার 3টে ভাগ আছে, উইদাউট সিম্প্যাথোমাইমেটিক অ্যাক্টিভিটি, উইথ সিম্প্যাথোমাইমেটিক অ্যাক্টিভিটি, উইথ আলফা ব্লকিং অ্যাক্টিভিটি। ড্রাগের নাম কিন্তু মনে রাখতে হবে, বিটা ব্লকারের নাম মনে রাখতে হবে। দেন ইউজ, কার্ডিয়াক ইউজ, নন কার্ডিয়াক ইউজ, and explanation how it helpful in hypertension, how it helpful in angina, how it is helpful in heart failure and in arrhythmias, in myocardial infarction. Explain wise. Clear?